As a doctor caught in the pandemic, sometimes it becomes very hard even to cope up with day-to-day activities. Being medical profession, it becomes so harder sometimes even to work in a ward without proper equipments. It's like fighting a war with a stick in our hands. If you are not given proper equipments, not given proper facilities and infrastructure, it becomes very difficult to manage a crisis situation like a pandemic. So COVID, when it struck the world, it actually created a lot of enthusiasm in terms of merging people together to support people, help each other so that we can get through this pandemic as early as possible. Life becomes so challenging sometimes. When you get a call, you're so tired even to answer that call or even to return a missed call. But I remember one fine day, I got a WhatsApp call from a beautiful lady and I thought it's my lucky day. But when she spoke to me, she asked me, "Are you Dr. Namal? And whether are you in a position to help us in terms of facilitating a donation from the Australian Sri Lanka medical team to Negombo Hospital, the COVID ward?" She is Dr. Irosha Premaratne, the president of the medical aid team in Melbourne. So let me thank Dr. Irosha Premaratne and also her team who facilitated this donation to Negombo Hospital with 3 oxygen concentrators and 2 CPAP machines, as well as multiple finger pulse oximeters, as well as nasal cannulas, tubings, in order to deliver oxygen for these patients who have critically ill with COVID pneumonia. Thank you so much everyone for your donation, and we appreciate this a lot. And I know the Australian Sri Lanka medical team is supporting Sri Lanka ever since the tsunami, and you have helped quite a lot of areas in Negombo. And I know your organization has helped so many areas in Sri Lanka where the need is required and where a government or the simple local donors cannot handle certain activities, and you have helped us a lot. Thank you so much, and I hope you will continue to give your support to the Sri Lankan people continuously. Thank you very much.
My name is Dr. Irosha Premaratne. I'm a general physician and an endocrinologist in Melbourne. I'm a part of an organisation called AUSLAMAT, or the Australia Sri Lanka Medical Aid Team, that has been assisting the public healthcare system in Sri Lanka since the 2004 tsunami. So for the past 16 years, many of our specialist teams have visited Sri Lanka and provided teaching and training of the local medical staff. And besides this, we have also sent over $8 million worth of medical equipment to upgrade the local public healthcare system. So during the COVID crisis in Sri Lanka, we have commenced an appeal, and in just 30 days we have raised over $100,000, from which we have bought vital medical equipment such as high-flow nasal oxygen delivery systems, BiPAP machines and oxygen concentrators. They have been air freighted to Sri Lanka and already distributed among 8 hospitals all over the country, including Negombo, Anuradhapura, Bandarwala, Koskama, Kamaragamuwa, Dehiyattakandiya, Kegol and Vathara. So we will continue with our efforts to raise more funds here and continue to support the Sri Lankan healthcare system. Thank you. So in the process of selecting which hospitals we should send the medical equipment to, based on a list provided by the Health Ministry in Sri Lanka, we contacted Negombo Hospital, and I discussed with Dr. Namal Vijayasinghe what their requirements are, and got more information about the current COVID situation in the local area. And so with his kind help, we were able to get the goods delivered to Negombo Hospital without any difficulties.
I'm Dr. Vikramartne, consultant physician, Negombo Hospital, and I'm the one who is currently managing the 2 COVID wards, COVID normal ward and COVID HDU at Negombo Hospital. At this moment, I would like to thank Dr. Irusha Premaratna, the President of the Sri Lanka Australia Medical Association, and for donating this equipment to our hospital. And it's really I really appreciate at this hard time we are facing in Sri Lanka, this crisis situation, and this is the need of the hour, I think, from our Sri Lankan colleagues who are residing in Australia at this moment. I got to know that you've been supporting some other hospitals in Sri Lanka as well. So I don't know how to thank you at this moment, because we are running our wards with great difficulty, even though government supports us at all times, but there are things that we have to we have to get help from the others. And we had actually the crowd, in even Sri Lankan crowd, was all supportive at this moment, and even the expected supported us very well. So once again, thank you very much, and really appreciate your great work at this moment, and hope you will carry your good work in the future. At the moment, at Negombo General Hospital, we have 3 wards. One is for asymptomatic patients, one is for symptomatic patients, and one HDU, and 4-bedded ICU. So at present we have around 100 COVID patients treating at this center, and as you know, the number of cases are going up day by day, and the number of people needing oxygen and intensive care is going up, and we face great difficulties with the equipment every day, and we don't have enough multi-parameters to manage patients, as well as pulse oximeters. Sometimes during the ward rounds, even in my ward round, I have to carry the pulse oximeter with me from one patient to the other, which is not the ideal situation, but those are the difficulties we face. And at past we had shortage of Venturi masks, non-rebreather masks, and all those equipments as well, and even high flow nasal oxygen machines also. We have some, but I think with the need increasing, we might struggle in the future if we don't get those things now. So if you are interested in helping us, please help with this equipment. If you are planning to donate in the future, these are the ones we really need.
I'm Dr. Nirmala Loganathan, Director, Negombo Hospital. Australia Sri Lanka Medical Aid Team President Dr. Irusha Premaratna and team, thanking you to supporting the crisis situation, not to DHH Negombo, another hospitals too, for your aids and the equipments. Without the donors at this crisis situation, it is not possible to overcome this COVID pandemic at Negombo especially. Thanking you again. I'm expecting your support near future. Thank you.